Hi, my name is Brooklyn. I'm a level 1 nursing student. I'll be following you today.
Okay.
Is there any way you can give me SBAR on your patient?
Yes, today we have Shanana O'Connor. She's a 34-year-old female, full code. She's on a renal diet with a 1,500 milliliter fluid restriction, and she's allergic to trimethoprim sulfamethoxazole. She presented today at 5:30 this morning in the emergency department complaining of fever, chills, and general malaise. She has a diagnosis of diabetes with an onset of 8 years ago. At the onset of 8 years of age, and she has end-stage renal disease, secondary to diabetic neuropathy and hypertensive nephrosclerosis. The patient was diagnosed with end-stage renal disease 1 year ago, at which that time hemodialysis was started 3 times a week. She was placed on the transplant list 3 months ago, and 3 months ago she also visited the hospital for a graft infection, which was resolved at her IV antibiotics. The patient reports having an increased blood glucose level, which she's not able to control with her insulin, decreased appetite, weight gain over the past few weeks, and minimal urine output with recurrent UTI. She's having recurrent UTIs and dark concentrated urine. She's not complaining of any dysuria, and nephrology has been consulted to provide dialysis. We are planning on performing hemodialysis today as per the patient's schedule. We plan to treat with ampicillin immediately following her hemodialysis, and we had blood cultures drawn in the emergency department, which we are waiting on the results of that. Her urinalysis came back and it has white blood cells present. She is up as tolerated. Vital signs are ordered every 4 hours. I-nose every shift. A titrated nasal cannula to maintain her O2 stat at least 92%. Blood glucose level will be performed at every meal and at bedtime. Daily weights, and she has a CBC with dip and a CMP ordered for Tuesday. She is on a sliding scale, and if her temperature goes above 101, we are to contact the provider. She's alert and oriented, although she is anxious and tired, and she does report some feelings of depression. She had an intake of 375 milliliters with only an output of 200 mils, so we want to check on that. Her last blood glucose level was 155, and her last vital signs were at blood pressure of 138/78, pulse was 95, her respiratory rate was 20, O2 was standing at 96, and her temperature was 101, so we will contact the doctor about that. And we're going to continue monitoring her vital signs, especially her temperature, performing blood glucose levels, obtain ordered labs, and medicate her as appropriate, and keep her pain level at an appropriate level.
Okay, I just have a couple questions.
Sure.
Why specifically is this client receiving this medication?
She was diagnosed with a UTI, and this is a broad-spectrum antibiotic that we're going to use to treat that.
And what action does the medication have on the body?
It's classified as a carbapenem, and it is a beta-lactam, which acts by destroying the bacterial cell walls.
When should you question administering this medication?
Because the patient has a renal impairment, we will monitor her closely, and if the patient was allergic to carbapenem, cephalosporins, or penicillin, we would withhold the medication.
Okay, does this medication have a therapeutic serum level?
No, it does not.
Which vital signs must be monitored?
We're going to monitor her temperature, blood pressure, and her heart rate.
And which physiological parameters should be monitored when the medication is being administered?
We're going to watch for signs of anaphylaxis, shortness of breath, flushing.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You want to tell the patient to report any pain. You want to tell the patient to report any signs of pain, swelling, redness at her IV site, and to watch for any signs of oral thrush.
And what interventions must be taught for taking the medication safely at home?
Because she has an IV, more than likely she's not going to take this home, so there's not really any.
Okay. What are the side effects and potential adverse reactions?
Side effects would be nausea and vomiting, diarrhea, rash. She could develop a superinfection and create oral flush or abdominal cramping.
And how will you know the medication is effective?
We'll know that medication was effective when her temperature goes down and her urinalysis comes back within normal range, free of microorganisms and white blood cells.
Okay, that's all the questions I have for now.
Okay, I'm gonna go in the room and administer these antibiotics. Would you like to come along?
Yes.
Okay.
Yes, come in.
Hello, Miss O'Connor. My name is Laura. I'm gonna be your nurse. The doctor has ordered some antibiotics for you today. I'm gonna wash my hands. How are you today?
I'm fine.
Good. Can you verify your name and your age?
Okono Shanana, 34 years old.
And any allergies to medicine?
Yes, I have allergies.
And what are you allergic to?
Trimethoprim, sulfamethoxazole.
All right. And I'm looking in the computer here, and I have Shanana O'Connor, and I do see your allergy in here to the trimethoprim sulfamethoxazole. And the doctor has ordered some sodium chloride for you, and he's also ordered imipenem cilastatin. It's an antibiotic to help treat your urinary tract infection. The normal saline could give you a salty taste in your mouth, and the antibiotic, you could develop nausea, vomiting, diarrhea, maybe oral thrush or some abdominal cramping. So if any of that happens, you do want to use your call light and let us know. Can you tell me what signs you would call me for?
They said if I have any abdominal cramping, if I have any dizziness, if I have any problems with my mouth, and then
Right.
mouth, and then let me call you.
Okay, so if you develop any of those, you make sure you call us and we'll come in and check, okay? All right, so I'm looking in the computer here, and the doctor has ordered the antibiotic and the normal saline for you. So we're going to start off by giving you the sodium chloride. All right, so we have here our sodium chloride, and I'm going to check the bag, make sure that it's intact, it's not expired, everything looks good. And I'm going to check my medication to the MAR, and on the MAR it says you're going to be receiving some normal saline, and this is normal saline is what I got here. I'm going to spike my bag, and then I'm going to prime my line. So I'm going to prime the line, make sure there's no bubbles and air inside of the line. Alright. We have another bag of saline. This bag. It's this bag. It's like sucking. Nothing now. Top.
So you guys think they that one?
Yeah, I'm just gonna leave that one. Anything else? There's none on the table right here?
There you go.
Thank you. Alright, Miss O'Connor, we have a fresh bag here. See if this looks a little better. Alright. Some technical difficulties. This happens in the real world. Right. Alright. So I got my normal saline. Checking my bag, make sure that this one is free and clear of any tears, rips, it's not expired. The line is primed. Scan your barcode. And let's scan the medication. Alright. And we do have a green light here. And I'm just going to document that. My wishes. Alright, and I have checked in the computer that it is the right time to give this medication. It is the right route. We are given IV. It is the right amount. We are given 30 mLs. And right medication, normal saline, and I do have the right patient. Okay, so I'm going to turn my pump on. And while I'm waiting for that, I'm going to assess the site, make sure that there's no redness, swelling. Do you have any pain? No pain? Okay. I am going to scrub the hub for 15 seconds. And I'm going to flush the line, make sure it's patent. And we are good there. Alright, now I'm going to set my pump up. Put my patient information in. another 0.9% saline. Catch my line. Open my line and start the infusion. So we're good there. Okay. So you might get a little salty taste in your mouth.
Okay.
Alright, now we are going to give the antibiotic. Again, I need your arm man. Stand on me. And we got a green light. Put my initials in here. Alright, and I'm checking this bag for any tears, rips. Make sure that the expiration date is good. Let's spike my bag. Make sure it's not lower than the antibiotic. Find my line. We're good. No bubbles, air tubes in it. Alright, and I have checked the MAR, and we are giving, to make sure we're giving the right medication. So it is the right time. It is the right medication, the antibiotic. The correct amount, 500 milligrams. Right medication is the antibiotic and the right patient. We've already verified that. And we're going to clean the hub here. We're going to pause the saline infusion, clean the hub. And I'm going to clean that just to make sure you didn't get dirty. I'm going to attach that to my secondary line. And I'm going to set my contact. open up my line. And it is dirty. Alright. And how are we doing? Any pain or anything at the site?
No pain.
Alright. And I did document in here the medication I was giving. And I did verify with the pharmacist to make sure that this was the correct medication and dose, correct form. Alright, everything's documented in here. So remember, if you have any signs of thrush or abdominal cramping or anything like that, to give us a call. I'm going to put your bed down in the lowest position, and you do have your call light with you if you need anything. Do you have any questions for me before I leave?
No questions.
Okay, and I'll be back in about an hour to check on you, make sure that everything's running smoothly and that you're still feeling okay, all right?
Thank you.
You're welcome. I'm going to wash my hands before I leave the room. All right, Miss O'Connor, you have a good day, and if you need me, you call me.
You too.
All right, thank you.
I just have a couple more questions.
Sure.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I reviewed her allergies, vital signs, and her white blood cell count.
Did this information affect your decision to administer the medication?
Yes, if she was allergic or her vital signs were abnormal, we would withhold the medication.
Did this information affect how you administered the medication?
No, it did not.
Okay, I think those are all the questions I have.
Okay, well, thank you. And I'm just going to document some more in here, and that's all we have for today.
Okay, thank you so much.
Thank you.